We get straight into it. We're going to dive into your experience with diabetes and technology, healthcare, and the whole bang shoot. So very welcome. It's great to have you.
Thank you so much, Tahan. It's really great to finally be having this conversation.
Unbelievable. I've been looking forward to it myself. So let's take a step back and look at your stories. Let's set the scene. If you had to say you worked in diabetes, we know this. You've worked in many years and you've worked in technology. So what drew you to this space? What interested you about it? What makes you so passionate about it?
So I studied nutrition, and I was able to really kind of custom make my degree to a certain extent. I studied in the UK, and diabetes was always kind of chronic illness of interest to me in my studies. So I got to already back then kind of tailor the projects I did and the assignments that were sometimes set around diabetes and diabetes related questions and or investigations. So I think my real passion started there already. So even while I was busy pursuing my undergrad and my honors degree, I then went into private practice for a few years and again saw many diabetics, like most nutritionists, dietitians, doctors, healthcare practitioners. And it grew, my interest grew and almost became a little bit of a bordering an obsession, and decided then later on, after a few years in private practice, to enter into the more corporate technology space. I got an opportunity to work with a company that was locally based in South Africa that was providing diagnostic, point of care and diabetes-specific technologies to the South African healthcare market, primarily the private market. And that really then just grew my interest in the technology side of both medicine and also specifically within diabetes, where technology truly is not a luxury, but a lifeline. So yeah, that's pretty much where it all started. And then, the obsession has just been fueled ever since.
So you've worked with companies like Dexcom, you work with Tandem. From these technologies, what are some of the most interesting and most powerful changes that you've seen made in the lives of people using these technologies in managing their diabetes?
I mean, the list is truly endless, but I'll give you an example. One of the very first patients I saw was a child that was living with type 1 diabetes and had been relatively newly diagnosed. The family, as with most families who find themselves in a position where they have come to the realization that their child has been diagnosed with type 1 diabetes, are usually thrown into a kind of whirlwind of change. It's a very difficult and scary world for most families. And the first thing that really goes out of the window is sleep, because there is the constant monitoring and testing and overvigilance and helicopter parenting to a completely different level, as it would be kind of generally understood. Met this family, this little girl and her parents, who were desperate to understand and support her, but also obviously petrified that she would, have either a hypoglycemic event in the middle of the night and not wake up. So sleep had been evading this family for at least a good 6 to 8 months. And I had the privilege of giving them a trial on the continuous glucose monitoring system, the Dexcom, which also has predictive alerts and alarms, but most importantly has something called a follow app, which allows the parent to actually have these alerts and alarms that go off on their cell phones throughout the night or any time of the day, even when the child isn't with them. But the biggest change that I saw within literally 24 hours was in the family's capacity to have had a full night's sleep for the first time in months. And the countenance on the faces had changed. The mom sent me a very tearful voice note the next morning just saying how incredible it had felt to have this kind of guardian angel, if you would, helping them, allowing them to have the peace of mind to have the little bit extra sleep. It wasn't a full, because unfortunately the alarms did go off, but it wasn't as interrupted, and they weren't waking up every 2 hours. Or in this case with this family, it was more regular that they were testing their child's glucose levels, and they weren't having to wake her up and traumatize her in the middle of the night to prick her finger in order to get that information to keep her safe. So I would say that was one of the first very big eye-opening experiences I had with the immediate effects, literally 24 hours. And that built over my career. When you add in an AID system, so that's the combination of the hybrid closed-loop system insulin pump with a real-time CGM, and in the case of the Dexcom, a predictive CGM. And that's kind of like the closest thing we have to a quote-unquote artificial pancreas. But what that all just inevitably means, again, is a reduction of the burden on the people who both live with type 1 diabetes specifically and type 2 diabetes, but also the people that care for them. I think that story is a story that really also continued to just showcase itself for me with the technology. Is it both empowers and gives the person living with diabetes back a part of their life, a part of their quality of life that was stripped from them the day of diagnosis. And it also gives back to the people that care about them, because that peace of mind for a loved one and makes a massive, massive difference. This is outside of the actual medical outcomes that it obviously also very positively impacts.
This is the thing. So maybe you can take us there. I think let's look at people who don't know, people who don't realize, even myself, to be honest, who doesn't have someone in their life who has diabetes, living with diabetes day to day. Obviously, I'm doing research currently and I'm speaking to people like yourself, and it really has opened my eyes. But for the most part, people who don't know what they don't know, right? So sketch the scene. I mean, me listening as someone who doesn't know the situation, having more alarms going off seems counterintuitive that that's going to be stressful. However, when I'm listening to what you're saying, it seems like those alarms are giving real-time information, as opposed to the opposite, which would have been just uncertainty, which makes you like have to get up and check manually. Whereas this thing monitors the glucose, as I understand it, monitors, overall health, those vital signs, that, if something then goes wrong, then for sure it is wrong. But the rest of the time, you can actually fall to sleep. You don't have to worry that you're sleeping and something's going to happen while you're asleep. Is that more or less capturing the essence of that? Please help me write it.
Yeah. So in essence, fortunately, anybody living with diabetes, the number one question mark that hovers over them all the time, and there was another brand of technology that actually had an incredible campaign that had this visualization of it, really, with a balloon that a child or a human living with diabetes was walking around with the whole day, trying to not let it get popped. It's a constant concern and it's a constant question mark. It's a constant unknown. There are physiological symptoms, physiological symptoms that patients are taught about, especially on diagnosis. And especially when they have the opportunity to get diabetes education, which is absolutely vital and very underfunded and very undervalued. But these physiological symptoms can help a patient. And before we had this kind of technology, was pretty much all the patient had to go on. Like, they were encouraged to test their sugar, particularly before and after meals. They were encouraged to also test their sugar levels whenever they felt funny, whenever they felt these physiological changes that would happen. Unfortunately, with the duration of condition and just in general, the hundreds of things that can actually influence your glucose levels and your sugar levels as they were, those things can sneak up on you, and they can also come at the most kind of terrible times and unpredicted times. For example, driving. Type 1 diabetic or a person living with type 1 diabetes is particular risk when driving, because they are not able to necessarily stop and test what's going on with their sugar levels. So they are only relying on their physiological feedback that they're getting. And even that can be potentially delayed. Diabetes might struggle to be able to respond even to those physiological symptoms. One of those times is something like driving, for example, is one of the times that people living with diabetes are most vulnerable to quick fluctuations. So either a very, very quick increase or a very, very quick decrease in their glucose level, both of which cause harm and can ultimately cause ultimate harm. So when you're driving and you're having these kind of sometimes delayed, sometimes not as easily felt, depending on the duration that you've had the condition, depending on hundreds of things that can affect every single human being every day: stress, hydration. The list truly goes on with regards to the things that can affect a person's blood sugar. But driving is one of the times that somebody living with diabetes is most vulnerable, because you can't just stop in the middle of a highway going, 120 hopefully, and test your sugar levels. It's an incredibly vulnerable time. And then just like I say, in general life, it's not as simple as just whipping out a blood glucose meter and testing your sugar. What's also missing from that information, a real-time finger stick, if you will, is what's happened before in your sugar levels and what's going to happen ahead of you. And that's why this kind of technology is absolutely groundbreaking, and it changes patients' lives immediately, because they're not only back in the driver's seats of their lives, knowing where they are and with a real-time glucose level that's being updated every 5 minutes on their phone, but they can see where they've been. And with predictive CGM, they can actually see a trend arrow of where they're going, and they can have these predictive alerts and alarms, which, as you rightfully point out, you think these alarms would be annoying, cause stress, more stress. And in some cases, with some patients, because every patient is different, every human being is different, that is the case. So there is something called alarm fatigue, and there's actually been quite a lot of clinical investigation into alarm fatigue. It's quite interesting. The countries where this kind of technology is fully funded and easily available have a lot more alarm fatigue than in the countries where we have to fight for funding and patients literally, are using their last little rands and cents available to fund it for themselves. Those alarms, though, in essence, when properly set by your healthcare provider and in consultation with your healthcare provider, and reviewed over different stages of your life and different times of the month and different times of the day, are a lifeline. Particularly the predictive, especially in the case of people living with type 1 diabetes, the predictive low alerts. Like I say, those in particular make a massive difference for children living with type 1 diabetes and their caregivers, but also for any adult living with any person living with type 1 diabetes, because fluctuations and particularly hypoglycemic events can cause a lot of damage and can cause them to be in a lot of trouble quite quickly if they are unaware of that creeping up on them. And these alerts help them to be proactive in their management.
What kinds of trouble could they get into, Bridget?
So, unfortunately, with diabetes, there are a list of complications that follow poor management, as it were. And poor management is in and of itself a bit of a taboo topic now, but just because it does very much place the onus on the patient to an extent which I think is, again, burdensome. It's very difficult to keep your management controlled, as all these words have become more taboo. But the reality is that the fluctuations that can occur in the blood sugar levels can lead to many, many complications. Nephropathy. There are issues, especially when it comes to hypoglycemia, where if you are below a certain glucose level for long enough, there can be brain damage. Patients can slip into comas and unfortunately also lose their lives. Some of the other more long-term complications include things like foot ulcers or losing circulation to their appendages, losing limbs, losing their eyesight. Unfortunately, there are a list of conditions that parallel as well, the chronic conditions that can obviously be exacerbated by or include or exacerbate the type 1 or diabetic management, if you will, because the body is a connective system. It has a knock-on effect to a lot of other systems and a lot of other parts of the body's regulation when it comes to these big fluctuations in glucose levels.
So no doubt it's very serious. Is that word
nephropathy?
What is that all about? That sounds very scary.
So nerve damage can be a result of, again, these fluctuations in glucose levels. There can also be a lot of damage to the eyes. So mostly people living with diabetes are really encouraged to go and get their eyes tested as often as they can, because those fluctuations also cause there to be damage to the eyes and eyesight. And
because really it comes down to within the arteries and the veins, if they get blocked because of these different proteins and blockages, is that what the big challenge comes in and that effect to eyesight?
Exactly.
How do you understand that? Or I would want to explain that to someone.
So generally speaking, it's the fluctuation, it's the pressure that's put on, especially the nerves and the smaller blood vessels that are found in the eyes and the feet and the appendages. So it's that pressure of the fluctuation that starts to cause critical failure or to cause them to be blocked or to cause there to be damage. And that damage obviously has a ripple effect on the ability of those organs. And for the example, again, with the kidneys and renal failure, these things are all connected to that fluctuation that they always kind of reference it as the variability. That's really what doctors, specifically endocrinologists, look at and what this kind of technology actually allows them to look at. So before, they just had these random glucose levels that hopefully a patient was taking note of, or hopefully their glucose meter was connected to a Bluetooth system that would have some data. But again, those are just like spot of data points. They're not connected, they don't have trends, and they can't tell this variability, because this variability truly is a better indicator of the patient's risk to any and all of these listed health concerns, complications, and the development of them. That reducing that variability is really the best way that we can combat and support patients living with diabetes.
Fantastic. I mean, you've actually touched on one of the questions I was going to ask about looking at the traditional way of managing diabetes versus the affordances of technology. And could you contrast that a little bit more than you just have? Because I know you can connect the data points better, you can tell a better story, and you can color in the overall health of that patient with the new technology analysis of that and the continuous monitoring. Are there any other contrasts to the way that these things were done or still done, I'm sure, but to someone who has access to technology and the modern devices versus someone who does not? What do those two worlds look like?
Unfortunately, they are ever dividing in a very kind of linear way. The old methods of management are self-testing. That relies on the patient to prick their finger multiple times a day, take note of what's going on with that real-time glucose level, make a treatment decision. That's specifically in the case of somebody living with type 1 diabetes who's needing to make those treatment decisions, particularly around meals as it pertains to the insulin that they have to take, or outside of that in general with somebody living with type 2 diabetes, have an understanding of how the foods that they eat impact their glucose levels. With a traditional multiple finger prick protocol, there are many challenges, as I've mentioned, because you don't have enough data to really make the best decision. So you often are overcorrecting or being too conservative or missing the opportunity completely to make any kind of constructive decision with regards to your glucose levels, which unfortunately in the type 2 diabetic population is a huge chunk of the population, because again, this technology is quite niche in spaces like South Africa, or available to very few people living with type 1 diabetes. But the impact it has on people living with type 2 diabetes is also clinically very relevant. But yes, so the alternatives are traditional finger sticks, and then in the way of administration of insulin, injecting yourself, whether it be with a pen or, unfortunately in our state institutions, even more primitive, the means of delivery of insulin, which again, for our pediatric community, our children living with diabetes, it can be a very scary thing to have to pull up insulin out of a vial and still inject themselves with big needles and things like that. And that unfortunately very much still exists in the South African space. I would venture to say that probably 80% of patients in South Africa are not able, probably even higher, probably 90% of patients in South Africa are not able to access the kinds of, even when it comes to the kinds of insulins available now, and the kind of insulin delivery methods that have made administering insulin a lot simpler. Our state patients being a prime example of this. And the drugs as well that are available for people living with type 2 diabetes have come an exponentially far way in especially the last 4 or 5 years. However, there is a lot of barriers to access for patients with regards to funding. So that divide in South Africa is very stark, and we still have way too many patients that have to face amputations as a result of these cumbersome and outdated and difficult to use and manage methods of looking after themselves as they live with this condition.
Wow, it really does paint a stark picture. I mean, it's bad enough having, to live with something like diabetes, but then the daily torture of, pricking your finger, plus, having to administer insulin through these more painful ways as well. It's just, it sounds very painful and even depressing. And I've also heard about, diabetes burnout and things like that, where it just becomes so much, because life is not always easy for a healthy person. Let alone someone who has to constantly monitor their health 24/7. So my heart really goes out to anyone with that challenge, and especially those who don't have as much of these more modern comforts. If there was one feature that you could just wish that everyone could have from all these technologies that you could give them access to, what would be the number one feature that you think, if you could just have that for anyone and everyone in South Africa?
Be real-time, access to real-time continuous glucose monitoring. That truly is the missing question mark. If you know what's going on with your glucose levels, you can make an informed decision. If you don't know, you're shooting in the dark, or
It affects
you're
everything.
being retroactive. You can't be proactive unless you know. And it was the original tagline of Dexcom back in the day, you always know. And I think that really speaks to the power of continuous glucose monitoring, particularly real-time, accurate and predictive continuous glucose monitoring. But to be honest, Stan, it is still a lifeline, even if it's not the most accurate CGM, it's still a lifeline to patients to have access to a continuous glucose monitoring system. The clinical data for the last 15 years has really been absolutely overwhelmingly, obvious that this is the one missing piece of the puzzle that makes of the biggest difference.
Absolutely. I mean, I can totally believe that. It's cliche, but knowledge is power. It seems it's more, very accurate to say that applies here. It really does empower the patient. It empowers the practitioner, the healthcare worker. Everyone then can make better decisions in real time, which I think is wonderful. So access, you've touched on that. Funding is a challenge in South Africa. There are so many systemic challenges and fragmentation in the healthcare space. One of the big issues, obviously, is affordability, as you've said, access. So what's the current reality, if you had to sketch that within South Africa, of people who need these technologies? How bad is it, and how far away are we from giving or getting this to as many people as possible?
So the landscape has certainly changed quite significantly, and also not as significantly as we would have hoped. Those of us who obviously have been in the space for the last decade, we have awesome advocacy groups in South Africa that have made a lot of difference. They're groups like Sweet Life and the Diabetes Alliance. There's a couple of key players that have truly come to the party when it comes to advocating for themselves. And I will also just say that people living with diabetes are some of the most resourceful and incredible human beings that I've ever met in advocating for themselves. For example, hybrid closed-loop technology was pretty much spearheaded by patients themselves who had built their own algorithms before any tech company decided that they were going to step in and create this solution. So they themselves are innovators. And so I need to take my hat off to them and surely always do. The patients themselves are phenomenal. And we really did see a start in the right direction, a really small but a really important move over COVID, where patients gathered and took their grievances and these are patients that have medical aid. So this is the really, really stark picture that I'm building. Patients with medical aid and medical aid with our top providers on the top plans. Still, many of them do not have access. It's absolutely disgraceful in all honesty. But up until 2020, I think it was actually the midway through 2020, 2021, I can very much be corrected. But up until then, there was no CGM benefit per se for patients. This is just for the continuous glucose monitoring now. The insulin pump therapy had been a little bit better funded, but it was very specific and very niche, and the two weren't necessarily being funded in the same way, or in a way that was considerable enough for patients to afford both. So there was a big chunk of time where, and still it exists, that some funders will prefer to fund an insulin pump even without a continuous glucose monitoring system as just an alternative means of delivery. It's just an alternative means of delivery of insulin specifically. So the patients have advocated for themselves brilliantly and continue to do so. It is unfair that that's their burden, especially considering the bulk of the information, the clinical data that has been available and around for both governments and our medical funders for the last 15 to 20 years. However, there has been this change, and so there is this benefit available now. It isn't available to all patients. It isn't available in a way that funds the technology 100% still. Most sensors are only really funded between 50 to 70% of the monthly cost from a quote-unquote now existing CGM benefit. It also is not just awarded. It requires an exorbitant amount of paperwork that has to be put through by their endocrinologists and their healthcare team, sometimes every 6 months, sometimes annually, and sometimes just on the onset of the application. However, in most cases within South African funders, the burden of the paperwork alone can put 50 to 60% of healthcare providers off from scripting it, as well as patients off from having to continually fight the battle to get the coverage that they actually deserve and that they should qualify for by simply being diagnosed. There are reasons for this. I do understand that there does need to be an understanding and an adherence, as it were. It's much like the idea behind taking your blood pressure meds. If you're not actually taking them, will the medical aid keep paying for them? However, it is a very, very clumsy, very rigid, and it causes exclusion for patients who truly do deserve to have access to this technology. There are one or two funders that are starting to think a little bit more out the box, and I do hope that they continue to do so and continue to allow access, full access, fully funded access, especially, again, I'll bring up the pediatric population who suffer the most, especially those living with type 1 diabetes. We have one or two brave funders who are venturing even into funding patients of low incomes. And the results are truly astounding, as they would be, because there have also been all these biases around having educational backgrounds in order for these technologies to be optimally used or to gain as much from them clinically as what you would hope. And all of those have been pretty much debunked, not only in South Africa, but internationally. It truly is not something that is a barrier. And so, there again, I would love to see more, especially of our big, very, very lucrative, is the word I'll choose to use, medical aids and funders in this country. I do believe that they are letting people with diabetes down significantly in the way that they cover and don't cover their customers at the end of the day.
It certainly seems that way. So, Bridget, you have touched on quite a few points, but I did want to maybe just unpack a little bit more. Why do you think that medical aids, if you had to spell it out, why are they still so slow in funding these devices, despite the benefits, even the preventive benefits that could impact their bottom line, because they wouldn't have to spend as much on treatment if they had spent more time on prevention? Do you mind venturing there? Without naming any names, although I would love to know who these funders are who are thinking differently, and I would love to celebrate them. But let's go for it. Let's not go there right now. But just, in terms of the names, but describe the ecosystem or the hornet's nest that we've got going.
Yeah, so the big pushback is, of course, price. So unfortunately, in South Africa specifically, we are importing these technologies, and they are coming in at dollar prices, generally speaking, I think across the board. There's one or two sensor companies now that I know that operate out of Asia, but generally also all dollar price. There are some obvious flags there that will go off in every South African's head. It is very difficult, very unpredictable to work with commodities in dollars, more now than ever, unfortunately. So the pricing is always the big pushback, to be honest, Sehan, and it is a very short-sighted vision. But unfortunately, that is how a lot of funders operate, is in the real time of the information, and most especially the exchange of the rands and cents. And so it is a predominant theme and pushback is the pricing of these technologies. And unfortunately, in the case of higher-end, more accurate, more stable technologies, that pricing is inevitably going to be higher. And so the pushback is inevitably, unfortunately, there. However, we have seen some incredible work that's come out of the UK from a key group of endocrinologists who have really pushed back because they had a very similar landscape in the NHS, this kind of short-sightedness around the cost versus the prevention and this cost saving. And in that space, they were able to do some really incredible research and really push back to their government to say, well, look, we've actually done this now, this exercise fully.
Crunch the numbers.
We've crunched the numbers and it doesn't look good. So rather, let's pay for these expensive technologies so that we can save in the long term on bodies and beds in hospitals and in all of these complications and in all of these specialist hours and visits and different healthcare providers who have to spend so much time. Yes, we still need them to definitely see people living with type 1 diabetes and diabetes general. However, we can drastically reduce time and energy spent and increase lifespan and quality of life, which is obviously the goal. Unfortunately, though, when it comes to markets, money and personal gain interest, investors, the way that the world works, and unfortunately the way that healthcare funders work, the outcomes are not always the most important thing that is considered. The rands and cents are. So that's really, unfortunately, the bones of it. It's the cost of these technologies. I know that when I was more involved, specifically with the technologies we spoke of earlier, we were constantly in negotiations with the companies that produce these technologies to reduce pricing. It was a full-on war that we engaged upon as much as we could and in the ways that were appropriate, but it is an ongoing struggle. There is hope. Like I say, there are the patients themselves who continue to fight that fight tirelessly. And there are newer, different companies coming to market that are bringing in cheaper, more affordable versions of the technology. And I think that is poised to only, I hope, that is my hope, and very many healthcare professionals in this space's hope, that is poised to really increase in the years to come, because now the cat's out of the bag. And so with regards to these technologies and these algorithms, they're not as tightly kept secrets as they were maybe 10, 15, 20 years ago. And so that demand places more pressure on the market and hopefully brings the pricing down. And the prices of these technologies have truly come down. There is a misconception that has not been the case. But having worked in that space, I know that they have. And they are going to continue to go down the more access we have. Because again, unfortunately, it's the capitalistic model. If more are being sold, the price can then come down. It's all supply and demand, unfortunately. But there is hope. I feel there is hope. I know there is hope. But it is a very stark picture, especially in South Africa for most people living with diabetes that don't have access to the funds that it requires, not only just to pay for their medical aid, but on top of that, to pay for these technologies.
So if there was one clear message you could send to policymakers and funders, what would that be? That
technology for diabetes is not a luxury, it's a lifeline. And that it has to be the number one priority, has to be the outcomes and not the bottom line. Because surely, I have been a part of very many very emotional presentations and marketing schemes. And there's a lot of that goes on in the medical space, especially within the commercial medical space. And I would really petition them to be authentic in the messaging.
I'm wondering more and more if it isn't a question of shareholder value, focusing on the next financial year. That's literally like the main focus for some of these companies, it seems. And obviously they employ, someone we both know recently shared with me how they employ so many people, juries and all kinds of lawyers and whatnots, so that to make sure they keep as much money as possible for as long as possible. And they call themselves a healthcare company. And so there's some issues there, some value, some conflicts of interest. So
correct.
I really do hope with you that this does change and that there's a disruption in the market, that these technologies aren't monopolized as much anymore and hopefully not as complicated. But you can imagine there's a lot of vested interest to keep those things under wraps as much as possible. Maybe it's not that complicated.
I tip my hat off to the patients because they are the true disruptors. They are the ones that actually, despite everything, stand together and innovate in a way that is truly incredible and very inspiring, not only in the space of supporting themselves, but in supporting each other, and in being brave every single day. Despite what they're facing, they carry on. They attack their day like the rest of us.
Absolutely. I mean, it's really is inspiring. So looking to the future, what steps could help move us closer to getting this technology funded? Is there anything that you've kind of thought of or conversations that you've been a part of that give you a glimmer of hope beyond what you've already shared?
Yeah, I think that the more awareness, that being a part of conversations like this, having people who are inquiring, having people who are willing to share and people who are willing to speak out, awareness is always the first step. And I think then there can be a groundswell of people going, hey, like, we didn't know this, or why is this so difficult? From all parts of society, really, that can get involved and that can really try to push back to move the needle. Like with anything in our society, I do believe it all starts with education and awareness. And as you started off saying at some point in the beginning of the conversation, knowledge is power. And in this case, the knowledge truly is power. And I do feel that thanks to a group of very brave and very strong and very relentless healthcare providers, especially, like I mentioned, even in the UK, pushing forward, pushing back, pushing on, that they are creating and paving a way for us to hop on that bandwagon, use that momentum, use that data to, again, join in that crowd swell. of momentum to push forward for access. I think that there are also a lot of people who live with diabetes that are taking to social media, to platforms to share their stories and to humanize people living with diabetes, because it has, for a very long time, there are still a lot of myths and misconceptions and ideas about what diabetes is and isn't, and what people with diabetes, living with diabetes, are and aren't. And I think that, again, the beginning point for me is the awareness, is building that awareness, and then being able to work together in, much like a person living with diabetes needs a multidisciplinary team. We need a multidisciplinary approach, and we need a multi-level approach to really make an impact. And we need to think smart, and we need to be armed to have difficult conversations and understand that we're going to have to come to the party with new and data-driven ideas, not just from a clinical perspective, but from a financial perspective. And it is tricky for healthcare professionals to come at things from a financial perspective. It's not their wheelhouse necessarily. And so I think that's always traditionally been a bit of a barrier, or just a little bit of a roadblock, because they're thinking outcomes and they're thinking clinical, and they're being expected to walk into a boardroom and talk numbers in a different way. I think now, though, that the tide is turning, and we have a lot of healthcare professionals realizing that they need to be armed differently for those conversations, and they need to take a different approach. And I do believe that access awareness will also keep driving this conversation forward. And I do have hope for the future. Like I say, we can see in other parts of the world where the ongoing, persistent nature of the cause has won and is winning. And so I think that there is a lot of hope that no matter where it comes from in this country, there are a lot of amazing people who are involved in this space and who are not going to quit, and who are going to keep trying to figure out new ways to disrupt, but to also, fight back on the narratives that these technologies are just expensive and that they don't, impact outcomes. Whatever the narratives are, that we take control of them, and we try to redirect them, and we push back on them. And so I would say I've seen a lot more, especially in the last few years, of that happening, and of that mobilization, and of that organization within the healthcare community, and within people and healthcare providers that work in the space, that are empowering themselves to really take it to the people that they need to take it to, and being brave enough. Because again, I think standing together definitely makes a big difference. If we're silos trying to each individually fight a battle that we feel like we're fighting on our own, not as many holes get poked through when we're standing together, and we have a much bigger impact. And I think that is starting to happen across this country. I know that most healthcare professionals who work in this country are incredibly passionate people who care deeply about their patients, and particularly in the space I have a privilege to have worked in, that is the same of this community. And so I do have a lot of hope that we can just keep building our arsenal and our data in every capacity to move the needle for patients.
Wonderful, Bridget. Your passion and your vibe is so inspiring. So thank you so much for sharing that and sharing your heart. Obviously, clearly, you're one of those professionals, healthcare professionals, who are just, fighting the good fight. And so I just want to commend you from this side as well. So thank you so much for this conversation. It's been so enlightening.
Thank you.
I appreciate you, and I appreciate you taking the time and being here with me today. So looking forward to the next conversation. Thank you so much.
Me too. Anytime. Thank you so much, Tehan. It's because of people like you that we get to have these conversations and keep building the awareness. So thank you so much.